My name's Dr. Andrew Clark. I'm a cosmetic physician from Perth, Western Australia, and I've been asked to speak to you about the Redensity 1 product from TSL, and it's also called the Beauty Booster treatment. And the first thing I want to talk about is who would benefit from the treatment, who actually enjoys having this treatment done, and why would we recommend it to them. And I think the answer is that patients who are already getting an appropriate amount of wrinkle relaxer, patients who have already had an appropriate amount of dermal filler and have had the sorts of improvements from those treatments that you can expect, they often still have skin that's not in the best shape. The skin might have suffered significant amounts of sun damage when they were younger, and the skin might be showing signs of wrinkling and crinkling easily when moving and smiling and expressing and animating. The skin might just be a little bit dry, and no matter how good the moisturiser, it never quite hydrates. And the skin might clients will describe that it's lost its elasticity, it's lost its bounce, it's feeling sort of tired, it's looking tired, and they're just generally unhappy with the skin quality. And this is distinct from pigmentation. Pigmentation, I think, is best treated with laser, and redness is also best treated with laser or IPL. But where it's an issue of skin quality, skin texture, skin hydration, then these are the perfect patients for the Redensity 1 treatment. When patients understand that it's about treating the skin quality and not the shape of the face, then they need to understand that you need 3 treatments to get this done to get a good result. If you do 1 treatment, the results are short-lived and they're not so dramatic, and the satisfaction rate is not incredibly high. When patients commit to doing the 3 treatments and they're fairly soon after each other, so around sort of 4 to 6 weeks apart from each other, then you see these amazing results and very happy customers. How do you do that? In our clinic, we sell it as a package, and so the cost of doing 1 is significantly more than 1/3 of the cost of doing 3. And that incentivises people to want to make the commitment to do the right number of treatments to get a good result. When and how do we introduce the idea of Redensity 1 to a treatment plan? The answer to this varies a lot according to your general style and your general approach, but my approach is that people want good advice, they want to achieve value for money, and when you offer the right treatment that helps them, they appreciate that, and they're more likely to listen to your subsequent advice. If they come in and their concern is skin quality, and they are aware and they can see that they've got problems with dehydration and they've got problems with crepiness and dryness and just a lack of elasticity and skin health, then yes, straight away we would recommend the Redensity 1 treatment. But not a lot of clients come in that aware of their problems. They're pointing more generally at the obvious wrinkles and the obvious hollows. And so once you win their trust and once you've given them effective wrinkle relaxing treatments and dermal filler treatments, and then they still feel that there's room for improvement and they're able to identify or agree with you that the problem is a skin quality problem, then that's, I think, the right time to introduce the idea of Redensity 1 treatments. Short-term benefits is that after the 2 or 3 days of lumpiness and bumpiness, their skin's going to have an amazing glow. It's going to be super hydrated. It's just going to literally glow. It's going to reflect the light nicely. There'll be a soft sort of moisturised appearance, and people will look really good without makeup, and with makeup they're going to look amazing because it's just going to sit on there and it's going to be so well hydrated that it's not going to crepe and fold and cause the makeup to break apart. It's very popular to get done about a week before, you know, a important event, photos, weddings, anything that's going to be photographed and remembered for a long time. With a 3D camera like the Quantificare camera, you can measure the smoothness of the skin before and after your treatments and therefore get an objective idea of your results. Sharon is now 2 months after her 3rd Redensity 1 treatment, and we can see using the Quantificare software that she's had a 14% improvement in skin smoothness and a 14% reduction in visible wrinkles and fine lines. Sharon's skin was already really good to begin with, but where I can see a massive improvement is the fine lines around her eyes. This is an area that's usually very difficult to treat non-surgically. Clients will get compliments about the quality of their skin, and they'll really appreciate having this done if it's done for the right reasons. From my interpretation of the rules and regulations, Redensity 1 is a prescription medicine or a medical device requiring a prescription. So in our practice, it needs to be administered by a registered nurse or a cosmetic doctor. It's most comfortable for the patient, and the patients will enjoy the treatment a lot more and want to come back for more treatments if they're comfortable. And this is best achieved with topical numbing. And for the topical numbing to be effective, it needs to be applied at least 60 minutes before the treatment starts. So in our practice, we arrange for our treating practitioner to prescribe the topical anaesthetic earlier on. And so usually before the patient comes in for their first beauty booster, they've already met and they've already talked with the prescribing doctor, and they already have a prescription for topical numbing. And then that means that when they do book in for the Redensity 1 treatment, one of our support staff, like a dermal therapist or one of the registered nurses, can meet them, remove the makeup, prepare the skin and apply the topical numbing an hour before the actual booking for the treatment time. If you have a way of organising this in your clinic and the way that your clinic works, then the customer experience is a lot better. The support staff will know what to do, and your customer will have the numbing cream on for the right amount of time, and when it comes time to do the treatment, it can start almost immediately, and it's going to be comfortable, and your patient's going to be happy to come back for the next treatment.